I'm Mike Hetrick. I'm the CMIO at Grande Ronde Hospital. I've been a practicing clinician, a pediatrician, for over 30 years, and have moved into this role as I retire from direct clinical care. My new role doesn't abandon that care, but is more of an interface between providing that care and collecting the data necessary to improve the care we provide. It has lots of potential to impact patients' lives in the same way, just less directly. In the same way that data-driven technology is becoming a part of medical care, and that's evolving pretty rapidly. This definition of a CMIO is evolving equally rapidly, you might say, so that someone designated as a CMIO 15 years ago is likely to have been having a different focus than someone who's designated as that right now. In the broadest sense, I think a CMIO usually, as is implied in the title, has a medical background. We're extracting data from giving medical care is new. We're only in our adolescence about this. You look out on the landscape and they always say, well, medicine's this last great enterprise in terms of our financial investment that we haven't digitalized, that we haven't tried to measure and quantify and improve with the use of data. And so we've invested all this money in medical care, but we haven't really applied the technologies that we're applying everywhere else. We're all learning from both sides how to do this well. As providers, we get very engaged with providing patient care. We get really wrapped up with it. And that's how we were trained to do it. And that's what the patients want. So this oftentimes, as I said, is an intrusion. So learning to modulate that, learning to ease folks through this transition phase on both sides of the coin, really, from the provider and patient point of view. I mean, that's probably the role that I'm supposed to play. We have a very unique opportunity here. And I think it's also, the terms are quite widespread there now about population health and precision medicine, and those concepts are all data-driven, and they're only as good, they're only as achievable as we have good data. This is going to be disruptive to do this, and we are going to, all of us at all levels are going to have to change the way we do some things, because it's really almost unimaginable to understand how our genomic knowledge is going to change our healthcare. We're just seeing the tip of the iceberg here with what we know now. Having a genetic profile and then tailoring your care, all kinds of decisions. We're at a point where there's, as disruptive as it is, in direct proportion to how disruptive it is, that's how much opportunity we have to create something better. And so it's equal. If it's really disruptive, you have more opportunity. And you got to keep that in mind, and you have to keep in mind the goal that we really want to provide health care, not just good health care today, but we want our health care to be one that adapts and makes it good for our children and our grandchildren, because it's going to be a lot different than what we're doing today.